way that we have designed our societies and our cities, and it's coming out. That kind of rugged individualism, the ability to say, you go your way, I'll go my way, and don't bother me. There certainly is that in the society, but I think that one needs to be observed that in some way we managed to glide through a lot of periods without it becoming as vocal and without it becoming as disruptive as it did this summer. The crisis that's created by conditions, by people losing jobs, by people losing their pensions, by people losing their health insurance, is the sort of thing which makes people say, I've got mine and I'm going to hold on to it very tightly. So I do agree with you in general, but I think that despite all the flaws of this society of ours, it still is a society, even though it's challenged greatly at certain times. One would hope that in this challenge people would see the need for soldiering together rather than going apart. Okay, is it Nelson? Yeah, I scribbled here. A multiple non-profit pay, the administration pays higher, and what do we now? What are we now to think of the bill? I guess that's about voting for it, whether we vote for it or not.
Yeah, that might have been me. It's Nathan.
Hmm?
That might have been me. It's Nathan.
Yeah. Oh, Nathan.
Yeah, I think
sorry.
that might have been my question.
Sorry, I scribbled here.
No problem. Sorry, I threw a lot at you.
Yeah, I think you're right on this. That if you're going to have private plans, it's going to be much more difficult to have some of the money-saving devices that you have in a single-payer system. Single-payer system, one of the features of a single-payer system, which I think will probably save a lot of money, is the feature that is also in the Canadian system, that you have global budgets for health facilities. And so you basically negotiate with the health department of your state or your nation a budget for a whole year, possibly longer, but let's say a whole year. You negotiate that budget and you try to use your facilities in a way that stays within that budget. But you're not billing people as they come in to pay for all of the things that are involved in the functioning of a hospital. So that is a big saving. And that's one of the things that you also point out is difficult about or is a limitation of the public option. It's a limitation of Medicare, because in the case of Medicare, you have to work in the cost to a hospital through thousands of individual charges, and that takes a lot of time and work, and you'll have that with the public option too, because you're still going to be dealing with hospitals which are not working on global budget. Okay, and it's also problematic about the bill that people will see that it's not working, and they will be sick of efforts to do health reform. That was the feeling of a lot of people in the early 90s with the Clinton bill, even though it was never put into practice. People looked at that, they said, if this is what we have to go through to get health care, it's not worth it. Let's forget about health care. We'll just stick with incremental reforms. And so during the next decade and a half, we did some incremental reforms, and that's all. And we dug ourselves into a deeper hole than we were at the start. Okay, Bob on California voted for it. So did Massachusetts before the Romney bill. So did Vermont. All of them vetoed, but that was a great hope that those bills actually were passed. In California, they've been passed twice and vetoed by the governor. Now, I think that the ERISA thing didn't seem to be featured in any strong way in those debates, because it was assumed that if a state as big as California, for example, passed it, there would be a waiver from ERISA. So many people think there will be a waiver for ERISA for any state that passes it now. But I think the Kucinich thing gives people a little freedom, saying we don't have to bother with that argument again. Now, the silence of the churches on this is some of our best supporters are church people, but we haven't had any news of stirring sermons from the pulpit about people going out and working for single-payer health care, which is, I think, unfortunate. The churches which do have a strong tradition of a social gospel should be there with us. But many of them have moved on to other things. Sexual morality seems to fascinate churches these days. It used to be liquor, now it's sexual morality. And hopefully they'll get back to the social gospel.